So why don't we start with how do we actually define disorders of consciousness and the levels and the types of things we see
Of
with it?
course, yeah. So dissource of consciousness is a state of altered arousal and level of awareness. So it can be from any type of acquired brain injury. When we say dissource of consciousness, a lot of the people picture traumatic brain injury. In fact, people can be in a dissource of consciousness state from anoxic brain injury, previous like stroke, encephalopathy. So when we talk about dissource of consciousness, we're talking about anyone with acquired brain injury that led to altered level of awareness and arousal.
Yeah, actually, so I think the meaning of DOC, disorders of consciousness, sometimes can be more complicated than that, considering its implications in ethical, legal, philosophical domains. For example, from a philosophical point of view, some philosophers believe that they define consciousness or describe consciousness as a subjective qualitative experience, like how would one feel like being themselves. That's how philosophers view consciousness. So from that perspective, the disorders of consciousness may mean the disorders of altered subjective experience. So it depends on, I think that there is a broader meaning of it. It's more complicated than it sounds like, because we don't have a really solid definition about consciousness. But right now, clinically, we view disorders of consciousness as a profound disruption in arousal and awareness of the patient.
And it sounds really just like, it sounds a really complex thing, right? What is even consciousness and how do we define that? But with that, my assumption is there's going to be so much like misdiagnosis and misunderstanding around it. What's your experiences with that?
Yeah, just like you brought it up, consciousness is an internal state. So there's really no way of directly measuring level of consciousness, right? So we have to go by the proxy, which is the behavior responses. You know I'm conscious because I'm talking, I'm moving, I'm interacting with you. But anyone who had acquired brain injury, there's leading to like severe neurological deficit where they cannot show you what they can do or show their internal state. It becomes very challenging to know where they are in terms of level of consciousness if they're not interacting with you readily because they're weak, they're too weak, having language deficits, things like that. So there could be a lot of confounding factors. So some of the literature says there's up to 40% of misdiagnosis rate where people who are labeled as unconscious, when they're actually looked into, they're conscious in fact. So that gives me chills, right?
Like, that's so high.
Where in the medical field would tolerate 40% of misdiagnosis rate? Like, for example, if we have 40% misdiagnosis rate in cancer, that's not going to be accepted, right? So that's also one of the things that reason why we advocate for rehab for disorders of consciousness patients, because there are a lot of thoughts that people who are not able to readily follow your commands or anything, they're not viewed as rehab candidate, which is why they're also missed out on this opportunity to come to rehab and marginalized in the society.
And this has been brought up to the field's attention, I think, more and more over the past few years or over the recent decades. So more and more research are looking into how to optimize the diagnostic process. For example, advocating for using standardized, validated evaluation tools like coma recovery scale revised. And also we're advocating for kind of repetitive assessment. It's not one-time assessment that can give us a solid answer. And these type of patients, they need to be evaluated in a systemic manner repetitively, and because their status may be changing over time too. And on top of everything, there are newer technologies being developed as well. For example, functional MRI, some EEG, task-based EEG paradigm that can help further identify signs of consciousness in patients without solid behavioral evidence.